So, Dr. Percy, you are responsible for HR and all these healthcare professionals. She is worried about the healthcare professionals. Just the perspective from the public sector and around NHI, particularly how this impacts the healthcare professionals. That's the first question. The second one is, you read anywhere there's this conversation around shortage of healthcare professionals in the public sector, and yet there are professionals graduating and somehow they're not in the employment. Maybe you can sort of help us clarify some of that.
Okay, no, thank you very much. Maybe let me start on the NHI part, because I think as a country, maybe it's a communication challenge.
Yeah.
You see, NHI, let's simplify it, has got two aspects. One, you've got the health sector reform, that irrespective of how you fund healthcare, you've got to keep on reforming your health system, because if you don't, you know where it will actually end up all its mechanisms and systems being, you know, where irrelevant.
Yeah.
Now, the funding aspect is actually what Prof, you know, was engaging on.
Yeah.
And that is where the major differences come from, and especially Section 33 of what is the Act now.
Yes.
If you go to the preamble of the NHI Act now, it actually talks about setting up a fund for the sole purpose of purchasing health services on behalf of patients. That is what it is about.
Yeah.
So it is a fund, but it should actually be funding a system that has got its own services. I think part of the challenge is that we've actually conflated the two.
Sure.
And because, for instance, people would say that when NHI comes, and I am actually wonder, I would like to say that magic day, that when it comes. So
is that not the day we all walk around with an NHI card?
So that aside, I think the issue around our health workforce. So I would agree there is a lot that, you know, we're in agreement on. I haven't heard anybody who says the health services should not be made available to all South Africans.
Should not.
I haven't heard anyone saying they should not.
Yeah.
Maybe what we've not engaged in is the mechanism of making sure that everybody, you know, where comes in. I used to be a general practitioner in Khayelitsha for close to 10 years in Khayelitsha.
Sure.
And obviously the people that were coming to me, once their medical aid is exhausted, because they were not coming to me only, so I was not the one exhausting their medical aid. They would then go to the Khayelitsha Day Hospital. Some of them meet me there if I'm doing sessions.
Sure.
Which basically means our patients go in and out between public and private.
Yes.
But what we don't have is a mechanism where these two systems talk to each other.
Sure.
So I think that's a major, you know, part that we actually have to deal with.
Yeah.
Regarding the health professionals, I would say that we train quite a lot of professionals. I think about 2015 or so, we bumped up, especially with doctors, from about 1,200 to about 3,000 a year.
Sure.
Nurses, we've never had a problem of production. It's absorption that's been a problem. But there are forgotten professions that are very critical, the rehabilitation professions. Your physios, your occupational therapies, audio and speech and so on.
Sure.
So there is a lot that we actually still have to cover, you know, on that, because when you look at occupational diseases and all that, you actually need more of those rehabilitation. And we're a high trauma society, you know. So there is a lot that we've got to do, especially with our education institutions. So what we're doing now is that we've got a body that I co-chair, between ourselves, National Treasury, and Department of Higher Education,
Yeah.
so that we can actually look at the production of our professionals.
Stunning.
But we need to know also that our professionals are highly mobile.
Okay.
And I don't think it's a wrong thing for young ones to go and work for 3-4 years outside and come back to the country.
Sure.
The only thing is that I think we've got to just change our mindset. I know that in the media, when somebody says, I'm thinking of going next year, then it's a big headline, doctors are leaving the country. No, it's not, And I would say that even in 94, because I was in Cape Town then, a number of colleagues left just before the elections, 3 years after they were back in the country.
Sure.
So I think, our understanding of what our country needs requires, for me, it's a call of leadership, both public, private, and the non-governmental sector, because we always talk public-private. We forget that a major part of health services is actually supported by the NGOs in this country.
Sure.
So those, for me, that's why I'm saying it's a call of leadership that we're able to pull all this together.
Lovely. Before it was teeing you off on the NGOs, but I want to sort of park a little bit. You mentioned that, we've got 3,000 doctors being trained potentially out into the system a year. And you said the issue is absorption. Just what's the issue? How do we solve it?
Yeah, well, I think we all know that our economy is not doing well. We know that we've got a high unemployment rate. And I think for a long time, people thought that when you qualify as a doctor, you've got an automatic job.
Yes.
It's never been, by the way. It's never been. No, it's never been. It's only that, for instance, when I qualified about, I won't tell you the years, you'll start estimating my age, When I qualified, it was not difficult to find a job.
Okay.
By that time, we're doing 1 year of internship, no community service or anything.
Sure.
So after internship, you could go to private practice and all that.
Yeah.
But as the years went by, and of course the pay reducing, then it actually became difficult to absorb people. So the principle is that even if you are a doctor or a dentist or what, you've got to apply for a job like anybody else. It's not automatic. That's number one.
Sure.
And I've always said that we've been seeing unemployment rising. It's actually arrived at the doorstep of medicine, which used to almost have guaranteed employment.
Yeah.
So how do we then resolve the issue? We're looking at a number of, policy reviews.
Yeah.
Currently, one of the issues that the Auditor General has been complaining about, Treasury complaining about, is that we spend a lot of money on overtime for doctors.
Okay.
Almost 7 billion a year.
No way.
But from the value, but from a value point of view, were really, in close I will say, yalambata,
Yes.
You don't have enough, evidence to show for it.
Sure.
So imagine if we were to actually save about, let's say, 4 or 5 billion of that, how many people we could be able to employ.
Yeah.
But of course, the other issue is that our economy is not doing that well. And Treasury is stretched out because those social grants might appear as if it's a waste, but for a family that's got not even a single person working, that is actually a lot of, relief. So Treasury has got to balance, and I think in the context then of how we fund our health services, if we're to put our heads together with the temperatures much cooler now after elections, I'm sure we'll be able to actually find each other,
At the temperature cooler?
But I think it's important.
We'll have another dialogue on that one.
But I think it's important for us to look at that because all the professionals in health, even those that we say they are private, they are trained in public institutions.
100%.
None is trained in a private institution, or very few of them do. I think there is a small number in nursing, but the majority of others doctors, specialists, and everybody, they're actually trained in the public sector. So, and many of them work in both public and private. So from a quality point of view, it becomes difficult to understand why quality would be poor when they're in a public hospital and good when they're in their own rooms. So there are those issues that we've got to deal with.